So there are different types of insulins available in the market. Here I have two types of insulin. One is a regular insulin, as you can see here. This insulin is short acting and it is clear. Another type of insulin is a combination of short acting and long acting insulin. This is 70-30, which has 70% long acting insulin and 30% short acting insulin in it. I'm going to now teach you how to give a subcutaneous insulin injection. So to fill up insulin, if the cap is not there, then you clean this area with an alcohol swab like this so that it doesn't have any contamination, and then you fill up the insulin. Then you can see the mark over here, 10 units, the 10 unit mark. I fill it up to 10 units. Now remove the syringe and tap to remove any air bubble. Injection is given around the umbilicus or on the thigh. So clean the area where you intend to give the sub-Q injection. Pinch with your fingers like this and inject insulin. Clean it with an alcohol swab. Do not cover the syringe until you have given the insulin, because it can hurt you, it can prick you.